Okay, this video is part 2 of Dr. Mcdougall quotes. These quotes are from the book. They're not in the same order as the book, but they're from the book John Mcdougall, the Doctor Who Fought for You, written by me, Pete Rogers. Okay, Dr. Mcdougall quote. The best way to prevent or reverse atherosclerosis is to reduce the amount of fat in the diet. Now that's a very important statement because there's all kinds of people on the internet trying to say cholesterol doesn't matter, sat fat's okay. All that stuff's a bunch of nonsense. There's mountains of data to show that decreasing the amount of dietary fat is the key thing to preventing atherosclerosis. And the reason is atherosclerosis is a blood clot, okay? That's been shown by the pathologists looking at it under a microscope. The two most famous pathologists who looked at atherosclerosis under a microscope are Gregory Sloop, and he's the author of the book I think it's called Hematopathology and Hematology with Hemorrheology. Gregory Sloop, MD, is his name, and cardiovascular pathophysiology. He's got videos on YouTube too. If you type in his name, Sloop is S-L-O-O-P. If you want to learn about atherosclerosis, he's the best atherosclerosis researcher in the world. The other guy is William Roberts. William Roberts also has a YouTube channel with videos about atherosclerosis. He's also a pathologist. He specifically is a cardiac pathologist. He wrote the best paper ever about coronary artery disease, and he did an autopsy on about 2,000 patients that died of coronary artery atherosclerosis. And, he came to the conclusion it's always diffuse, it's always of a similar severity in all three of the coronary arteries, and atherosclerosis is a blood clot. That's a very important statement because once you understand it's a blood clot, then if you avoid the things that cause blood clot, you lower the risk of atherosclerosis. And fat is a major cause of arterial thrombosis because it sticks the red blood cells together. What is a clot? A clot is red blood cells stuck together. Also, platelets get factored in there and clotting proteins, but high-fat meals stick the red blood cells together. Now, that's especially the saturated fat and the omega-6 fats. Okay, they're both bad, but omega-3s have problems as well. We're going to come to that in a little bit. And, it's not just the research of those two cardiac and atherosclerosis pathologists. Armstrong and the monkeys, they found too, you reduce dietary fat, you reduce atherosclerosis. Dean Ornish, his paper showed you reduce dietary fat, you reduce atherosclerosis. Caldwell-Esselstyn, his paper showed you reduce dietary fat, you reduce atherosclerosis. Plus, this had been seen, a long time ago. Like Dr. Mcdougall says, it's been known for a long time that you can reverse atherosclerosis with a low-fat plant-based diet. Walter Kempner showed the reversal of many EKGs. Nathan Pritikin had shown atherosclerosis reversal in his patients, and Dr. Mcdougall himself had shown atherosclerosis reversal in his patients. Okay, but the randomized controlled trial of Dean Ornish was, more compelling, when you put it into that format. And the data of Caldwell-Esselstyn was also quite impressive, including his long-term follow-up and then his 4-year paper, in the Journal of Family Practice, July 2014. They both got videos on the internet if you want to study that some more. Okay, so let's continue with Dr. Mcdougall quotes. All forms of dietary fat increase the risk of obesity, diabetes, and hypertension. Dr. Mcdougall also says the fat you eat is the fat you wear. So the point is you can't hide from the fat when you eat omega-3s. You get plenty of omega-3s in low-fat plant foods. So when you seek them out with extra supplementation through fish oil or algae, you're just adding to your overall fat intake, which is not a wise thing to do. Okay, Dr. Mcdougall continues. High-fat diets increase the risk of leaky gut and autoimmune disease. Typically, when a person eats a higher fat diet, they're getting that fat typically from, animal foods like meat, also from oils, and those have no fiber. There's no fiber in animal foods. There's no fiber in oil. Oils are liquid fat. They're also toxic to the gut lining, the gut epithelium, the enterocytes. It's all the same thing. And so, fiber is the main thing that protects the gut lining. So you eat plant foods, you get the fiber. Plants always have fiber. Animal foods never have fiber. Okay, Dr. Mcdougall continues. A hot dog is a ground-up animal. It contains thyroid tissue. This can lead to thyroid autoimmune disease. So the thought is, you're eating animal foods, you're at an increased risk for leaky gut. Because there's thyroid tissue in the ground up thyroid, some of that can get across the leaky gut. Leaky gut means increased intestinal permeability. Because it gets across the intestinal lining, it then comes into contact with the person's immune system. The immune system can form antibodies to the foreign thyroid material. However, the thyroid material coming from another mammal is similar enough to our own. So it's different enough from us that our immune system forms antibodies to it, but it's similar enough that those antibodies can cross-react with our own bodily tissues, our own thyroid, and that'll cause autoimmune disease like Hashimoto's thyroiditis. So the formal medical description for that term is increased intestinal permeability with resultant protein intravasation across the gut border and subsequent formation of antibodies with molecular mimicry, meaning the amino acid sequence of the protein and the animal thyroid mimics ours, molecular mimicry, our own thyroid proteins. And then autoantibody, auto means against self. Antibody is the immune system forms these binding proteins that target it for destruction. So autoantibody, cross-reactivity, it reacts with our own body. So that's the formal term. But the bottom line is leaky gut causes autoimmune disease, and you want to avoid it. The simple way to avoid it is eat plenty of fiber and avoid the things that damage the intestinal line. I've got videos about leaky gut. Dr. Mcdougall has entire lectures on not leaky gut specifically, on autoimmune disease. Okay, let's continue. Here's Dr. Mcdougall. There's plenty of omega-3s in low-fat plant foods. My concern about omega-3 supplements is that they suppress the immune system. There is considerable evidence that fish fat, omega-3 fats, will increase a person's risk of cancer and will also increase the risk of metastasis. Fish fat is known to paralyze the action of insulin. Okay, this is described in more detail in the Dr. Mcdougall newsletter from February 2003. To see the Dr. Mcdougall newsletter, you just go to his website, which is drmcdougall.com. And then there'll be a search box like under education and newsletters, and you can find it very easily. So, a couple points about this. There's associated with increased risk of prostate cancer in humans. That's known. In animal studies, there is increased incidence of metastatic tumors. In 2 studies that I'm aware of where the rodents were supplemented with omega-3s. There's an Irish lady by the name of Lydia Lynch at Harvard. She's now moving her lab to Princeton, and she did some studies showing that high-fat meals, they paralyze the immune system, okay? They block the activity of both the NK cells of the innate immunity and the cytotoxic T cells of the adaptive immunity systems. So they really have a major damaging effect upon the immune system. Not good. Okay, next quote from Dr. Mcdougall. It is impossible for a diet to be too low in protein. That's a big statement. It is impossible for a diet to be too low in protein because all these, inexperienced people, they think that you need more protein. No, the smart move is to reduce your protein as much as possible. I explained in the lecture just done yesterday. The lecture was called For Beginners, How to Live Longer. Okay, and the point of the matter was, Walter Kempner had shown, the low protein diet was very protective on health. And the big gist of it was the discovery of this guy, James Mitchell. He's a PhD at Harvard. He had a really good lecture at the Buchinger Clinic. I put the link to it in that lecture I just mentioned, For Beginners, How to Live Longer. The point of it was when people ate a diet low in protein, there were less amino acids available for the liver to use for gluconeogenesis. That means the conversion of the amino acid into glucose. The most important job of the liver is to maintain blood glucose levels during fasting for the brain. The brain is like the most important thing in the body, and the liver is the servant of the brain to make sure it has adequate glucose available. So the point was, under conditions of high protein availability, the liver uses a significant amount of protein, amino acids, to convert into glucose. However, when you don't have extra amino acids sitting around for this purpose, the liver is then more likely to call upon fat reserves, and it'll take the triglycerides out of the fat reserves. It'll take in particular the backbone, the 3-carbon backbone of a triglyceride, which is called glycerol. A triglyceride means that you have a backbone glycerol molecule with 3 carbons in it, which is like basically half of a glucose molecule. And it's combined to 3 long-chain fatty acids. So the long-chain fatty acids serve no purpose at this moment. And according to Dr. Mitchell, what he says happens is that those long-chain fatty acids get sent to the brown adipose tissue. That's called BAT, B-A-T, brown adipose tissue, and it burns them off for heat. So this is actually wonderful news. If a person wants to lose weight, the smart thing to do would be eat low protein diet, because you'll facilitate burning of more of your fat, burning more of your triglycerides. And then people say, well, what about becoming protein deficient? It's impossible to become protein deficient. People don't realize how little protein we need. Dr. Mcdougall goes into this in separate lectures. He has an entire lecture. It's a great lecture on protein. It's called the Protein Mastermind Lecture. You just type Protein Mastermind into YouTube. You will find it. It's at his YouTube channel. Okay, so anyways, breast milk only has 5 to 6% of its calories from protein, which is very low. The average American's eating, like 15 to 20% of their calories from protein. So, what I'm saying is it's impossible to be too low in it, because look at the starches that are low in protein. Sweet potatoes is just about the lowest one, 4.5% of its calories from protein. Rice in the ballpark, 7 to 8% of calories from protein. Potatoes, about 9% of calories from protein. So those are great foods. When you look at meat, look at something like salmon, fish, salmon. It's 50% of the calories from protein, 50% of the calories from fat. That's a terrible food. Okay, it's very high in protein. It's very high in fat. So fish is a bad food. Don't let anybody tell you otherwise. All animal muscle is very similar. Dr. Mcdougall later has a quote, a muscle is a muscle is a muscle. It's all pretty much the same thing. Okay, so the point of the matter is, even during the baby's initial development as a newborn, which is its most rapid phase of growth ever in its life, it only needs about 5 or 6% of calories from protein. Human breast milk is perfect for babies, okay? So later on in life, you need less. And there's been studies, in my Pritikin lectures, I've got the references, where they fed starving people to bring them sort of back to health, 2.5% of their calories from protein. They did very well on that. There's been other studies where they had to restrict protein with patients, and they were fed similar amounts, very low, and they did very well. So it's impossible to be too low in protein. Dr. Mcdougall has said he has never in his life ever seen a patient deficient in protein. Okay, the next quote from Dr. Mcdougall. It is impossible for a diet to be too low in calcium. That's another important one, because for meat, the selling point quite often is that it's got protein. And then for dairy, the selling point quite often is, well, it's high in calcium. But the truth of the matter is, you want to reduce your dietary calcium. You don't want to be increasing your calcium. As Dr. Mcdougall says, it is impossible to be too low in calcium. Impossible. You can't eat any naturally occurring diet and be too low in calcium. All right? He's never seen a calcium deficiency due to diet ever in his entire life. Okay? Nor have I ever, seen one in any of the books I've read. Nor have I ever seen a protein deficiency. That's an important statement. Because a lot of people think, I got to get my calcium, I'll get osteoporosis. That's not the issue, getting your calcium. That's a sales pitch from dairy. Dairy actually causes increased osteoporosis because animal protein is high in sulfur-containing amino acids like methionine and cysteine. And part of the metabolic degradation of these amino acids is some is converted into sulfuric acid, which causes a low-grade metabolic acidosis. Then the body has to buffer that to maintain the pH, the number of hydrogen protons in the blood. And calcium from bone is one of the sources of calcium for buffering. Some comes from the muscle too, but when that calcium comes from the bone, it is then excreted from the kidney simultaneously with the hydrogen protons. So the kidney excretes the hydrogen protons, the acid, but it simultaneously couples that to excretion of calcium. And that coupling of calcium means that calcium is taken from the body and peed out into your urine. You pee your bones into the toilet. And that calcium causes additional problems. With the calcium accumulation in the kidney, some of it sometimes precipitates, and it can cause kidney stones, which can be very painful. They can also, over time, lead to a loss of kidney function. When a person has a big kidney stone, they have to go for surgery. Sometimes they can fish it out from below, transurethral approaches, basket it out, lithotripsy and all that. Other times they have to do a percutaneous nephrolithotomy. It's like a surgical entry into the kidney through a large diameter nephrostomy tube. I used to do those procedures. And you're always going to damage some kidney tissue when you do those. Plus, kidney stones are very painful. You don't want that. Okay, the bottom line, forget about calcium. One last story about calcium is the Bantu women. The Bantu women in South Africa, they would typically have, just like most women who don't, not in the modern world with birth control, they would have about 10 children or so. They would tend to breastfeed them for about 2 to 3 years, typically like around 3 years. And so they're giving the baby a lot of their calcium. And they would only drink a tiny amount. They'd only eat or drink a tiny amount of calcium, the equivalent of one small cup of milk much less than a Westerner, but they don't have any problem with osteoporosis. It's more important to exercise, eat a plant-based diet, avoid the acidic animal foods, and forget about calcium. It is not the issue. Women who took high amounts of calcium supplements, over 1,400 milligrams per day, they had a 2.6 times increased death rate from cardiovascular events. What I think is happening is that it causes a transient hypercalcemia in the blood, which is prothrombotic, because calcium is a clotting factor. And I think that's predisposing them to forming coronary artery blood clots, atherosclerosis, myocardial infarction, and heart attacks. Okay, Dr. Mcdougall continues. I get asked, why are people so sick? And I tell them, it's the food. It's the food. Food's the most important thing in health. Yes, there are other things that are important, but food is the most important thing. Dr. Mcdougall approximates 75% of disease is caused by a bad diet. So that's the most important thing you could fix. Yeah, you want to fix the other stuff. Get your sleep, get your rest, manage your stress, maintain your social support, all that. Yeah, that's great, but the food's the most important thing. Dr. Mcdougall continues. Good health information gives people the opportunity to have a better life. The most important thing in medicine is the food. If you want to get the cure, you must stop the cause. In order to get the cure, you must stop the cause. And the cause most often is bad food. And most commonly, especially animal foods and oils. Okay? Nutrition is actually becoming more complicated, and I think toxicology is becoming more relevant than it used to be. But still, the most important thing to health, avoid the animal foods and avoid the oils. Okay, Dr. Mcdougall continues. The paleo, keto, low-carb, high-fat promoters have money on their side, but we, the low-fat, starch-based vegans, have the truth on our side. The truth don't change. People love to hear good news about their bad habits, so they can go on eating all the junk food. Okay, Dr. Mcdougall continues. The keto diet stuff reminds me of what P.T. Barnum said. There's a sucker born every minute. Yes, I totally agree with that. And what's happening is big food, big pharma, etc., they have to pour lots of money into promoting animal foods and oils because they have to keep people sick. If people were healthy, they wouldn't make money off them. For example, I'm a low-fat, low-sodium, low-protein vegan. Nobody makes any money off me. I'm 60 years old. I don't take any pills. I don't have any health problems, okay? Everything works. Imagine if the whole population was like that. The medical system would go broke. And people say, well, aren't I scared to talk about it? Aren't I afraid the medical system will go broke? And I'm like, don't kid yourself. 99.99% of people have zero interest in veganism. This is only for the small percentage of the population smart enough, motivated enough to seek out this information. And I think it should be available to them. But I don't see healthcare ever changing in my lifetime. It's big business, man. It knows what it's doing to make money. Okay, Dr. Mcdougall continues. The treadmill stress test is a conveyor belt to the cardiac cath lab and to the operating room. Now that's an awesome metaphor. It's perfect. Okay, the widowmaker, like a left main coronary artery stenosis. The widowmaker coronary artery lesion is a sales pitch. Yep, that's what they tell patients. That's what they told my father. I was young at the time. Gosh, it was about, over 25 years ago. And I didn't know enough. I had read Ornish, and I tried to talk my dad about going for open heart surgery, but I didn't know enough to fully talk him out of it. And he kind of got bullied by the cardiologist and the cardiac surgeon. Oh, no, he's got a widowmaker. He needs to go to the OR. He needs to go to the OR right away. And he came out of it okay, but he had a stroke 4 years later, which I think was related to his CABG, coronary artery bypass graft. And that really messed up his life. He had to retire then. He was sad. So let's see. What does Dr. Mcdougall all say? He says it's a sales pitch. Yes. He says coronary artery stents do not extend life. Not at all. That's a big statement. And nor does CABG. For the typical coronary artery bypass patient who has, let's say, chronic stable angina, stents and cardiac cath do not increase the lifespan. That's an important point. They can have a therapeutic benefit to decrease cardiac angina, symptomatic chest pain on exertion. In the acute myocardial infarction setting, coronary artery stent can save their life by reopening the artery. But most patients are chronic. Okay, so Dr. Mcdougall quote continues, coronary artery stents do not extend life, not at all. And then he says, I have a tattoo on my chest that says do not cath. So Dr. Mcdougall, you can see it. If you just type in Dr. Mcdougall chest tattoo, you'll see the cardiac cath, do not cath on his chest. And he said that he didn't go to the hospital when he had his pelvis fracture because he was afraid if he was sedated, they would take him to the cath lab and end up stenting him or doing open heart surgery on him. So anyways, that concludes our part 2 of Dr. Mcdougall quotes. Hope that was helpful.